are listening to the Careers for You podcast, the podcast aimed at Bournemouth University students and graduates. Each episode, we talk to employers, alumni and professionals all about their career journey, what employers are looking for, and help you explore the opportunities that are available to you. Hello and welcome to this episode. I'm your host Amanda Fripp, Careers Advisor from Bournemouth University. In today's episode, I chat to Isabella Zdesar. Isabella is a trainee on the NHS Graduate Management Training Scheme. In this episode, we talk about her role and the experiences she has gained on the scheme, as well as the stages she went through in the recruitment process and her tips for making a successful application. Welcome, Isabella. Thank you for joining me today. Do you just want to introduce yourself and your role?
Yes, so my name's Isabella Zdesar. I'm currently on the NHS Graduate Scheme. I'm in my second year in my final placement, and I'm currently working for the surgical care group at University Hospitals Dorset. So I'm working with the senior management team, and I'm doing a range of improvement projects. So some of the stuff is around demand and capacity modelling, so looking at how many people in the population need to access a service, and then looking about the practical constraints we have in terms of offering the right amount of appointments and having the correct amount of staff. And then some other projects related to safe medical staffing and what safe means on wards. So I don't have an official title. I work with the senior management team in the surgical care group at the hospital doing improvement.
Okay, lovely. And how long is that particular placement for?
So it's a 10-month placement. So I started this placement in November, I believe. So officially the end is August, September, but you can drop off the scheme slightly early depending on a variety of different things.
Mm-hmm. Okay. So let's talk a little bit about, we will talk a little bit more about kind of the role the roles that you've been doing in the NHS. But prior to the NHS, I know you're not a BU graduate,
No.
but can you just tell me a little bit about your educational journey to date and what you
Yeah.
studied?
Yes. So I actually, when I did my A-levels, I thought I wanted to be a doctor. So I did biology, chemistry, maths and art. I didn't get the grades I needed to be a doctor, but that's okay. So I went on to St Mary's University and I studied health and exercise science. I wasn't really sure what I knew I wanted to be a doctor initially, so I was interested in health. So I did this because I had the right grades for it and it seemed interesting. So I went into it and did that with an open mind, but I really actually enjoyed it. And there were some modules specifically we did like an introduction to public health module. We did behavior change, we did health promotion, and those were the ones that I found really, really interesting. And in fact, before I started that course, I had quite an individualistic approach to health and the way that health is delivered, and I thought that people were kind of responsible for their own health and that people just needed to be educated, and that was the issue. And if everyone understood how to look after themselves properly, then we'd all be healthy. But that course completely flipped my perspective, and I was introduced to the wider determinants of health and understanding about health inequalities and how it's all it's about your environment, the people you hang around with, the housing you have access to, like all of those kind of things, and they impact your health the most. So I found that so fascinating, and I decided to then go on to do a Masters of Public Health, which I did at Imperial College London. And I really, really, really loved that. It was incredible. It was really intense. It was 5 days a week, 9 till 5, but it was everything that I'm passionate about. So I did that for a year, and I suppose that's it. And also it's quite nice for me, having not done as well in my A-levels as I thought I would, to then be able to say that I managed to do my Masters at Imperial. It was quite nice for me to find my way and actually do well after feeling like I'd done so badly at my A-levels. So
cool, excellent. And at what point did you think you decide to apply for the NHS Graduate Management Scheme? Is that something that you were always interested in, kind of when you were studying, or when did you hear about it? When did you want to apply?
Yeah, so when I finished my Masters, I wasn't sure exactly what I wanted to do. I was kind of looking around for jobs. I was looking at graduate schemes as well. I liked the idea of a graduate scheme because you've got kind of like a protective bubble around you in terms of being a trainee. And then also you get kind of a breadth of experience that you wouldn't probably get if you went through like a traditional careers route and in quite a fast amount of time. So I didn't go straight into the scheme. I finished my Masters. I started volunteering at a vaccine clinic. And while I was there, I was thinking, I quite like working for the NHS. Let me apply for the graduate scheme. So I applied for that graduate scheme and I applied for another one as well, but I got onto the NHS one.
So, can you tell me a little bit about the graduate scheme then? How is it structured? How many placements do you get to do?
Okay, so there are a couple of different specialisms on the scheme. So I'm on the general management scheme, but you could also do HR, finance, policy and strategy, health informatics, and health analysis. So it depends on what scheme you're on, but generally, well, they're all 2 years, and generally it's two long placements and one short placement. So you have your first placement, which is a year, your second placement, which is actually your flexi placement, which is 8 weeks. And then your final placement, which we call your second placement, which is slightly confusing, is 10 months. And generally speaking, you'll do an ops placement and a strategic placement. And the reason they do that is we have these competencies that we need to achieve. And you need a breadth of experience, including planning and strategy, as well as day to day operational management in order to tick those competencies off. So, yeah, broadly speaking, it's very slightly per specialism. But for me in general management, I've got a year, an 8 week flexi placement, and 10 months afterwards. And the two long ones you're assigned to kind of like nationally that's organised by the scheme, the Leadership Academy. And then your 8 week placement, that's up to you. You can decide where you want to go. You can do it anywhere. It doesn't have to be in healthcare. Lots of people go into consultancy. Some people will go, I know a girl that went and worked for a ballet company. So there's loads of different things that you can do. Yeah. And you organize it yourself. And you're a free resource to whoever you're going to. So it's quite handy. You can kind of reach out, use LinkedIn to meet people, and find a placement. And they're normally really happy to have a resource.
Oh, wow. So, it doesn't have to be within the NHS, that
No,
the 8 week one doesn't have to be.
no. So that's the middle one. Yeah. Exactly, that's right. Yeah. It can be literally anywhere. It doesn't have to be related to health. Although I did do mine for Public Health Dorset because that's my kind of interest area. And I didn't feel that I was getting more of a system because of the placements I've happened to get. I felt that was kind of like closed a gap that I felt I was missing. So that's why I chose to do it there.
Okay. And when you applied for the scheme,
Mhm.
did you choose what pathway you wanted to go into at that point?
So when I applied for the scheme, you have to. I think you have like top choice, second choice, that kind of thing. So I chose my first choice was actually policy and strategy, but there's limited places on that, and so second choice was general management, and I got onto the general management scheme.
Okay. And then
Yeah.
what placements as part of that scheme? Obviously, you're doing your placement now, but what other
Mhm.
placements have you done as part of it? Then you mentioned one of them.
Yes, so my first placement, so I'm currently at University Hospitals Dorset, like I said. My first placement was in the strategy and transformation teams. That was my strategic placement, at UHD. And I don't know if, yeah, I mean, you might know, being from the local area, that the two, the Bournemouth Hospital and Poole Hospital are merging. So I was working a lot around that merger and looking at um, how we can get teams to integrate basically, and doing a lot of planning around what the sites might look like when things have moved around basically, and lots of other stuff too, like loads of huge variety, quality improvement stuff. I did some stuff that was to do with like staff wellbeing, so there was loads of different stuff to do. That was for a year. Then I did my 8 week placement at Public Health Dorset, and I did some work on anchor institutions and how organisations in Dorset can deliver social value basically. And then my final placement is in a surgical care group, doing improvement basically again.
In terms of the experiences you've had on placement, how has they affected maybe your decision of what you want to do after it?
Yeah, it's a good question. And to be honest, I'm still not 100% sure exactly what I want to do afterwards. I think I'm quite open minded. I've learned a lot about my working style, how I am as a person, the types of people I like to work with, the fact that I like coming into the office. I prefer that over working from home. So all of those things I think will influence when it comes to applying for a job, the type of job I apply for. But in terms of the actual job that I do, I'd always thought that I wanted to do something quite strategic and public health related, given that that's what I studied and what I'm really passionate about. But I've actually found that I get quite high level of job satisfaction out of delivering things operationally day to day.
Mhm.
So the main thing for me would be finding a team that I really want to work with in an organization that has good values and a good culture. But I think probably immediately afterwards I'd try and do something operational just so I have that kind of broad base of experience, maybe for a year, and then I might think about doing something more strategic afterwards.
That's interesting to see how you're reflecting on those experiences to kind of find out what's important to you.
Yeah, and the scheme is really actually very good for reflection. It's massive. One thing I didn't mention when you asked about the structure, there's an educational component. So I'm currently doing a PG dip in healthcare leadership. So at the end of the scheme, we can make that up to a master's if we want to by completing the dissertation. But everyone gets a PG dip or a qualification. The people who do finance get an accountancy qualification. So, yeah, a massive part of that is reflection. So we have these work-based assignments, which are 500 words. I think throughout the year I have to do 10 of them or 15 of them, 500 words, and it's really reflective about what you've learned over that period. So I found it like really good for my personal development and just understanding how I am as a person, how other people perceive me, what I like. Yeah, there's loads of opportunity for reflection throughout the scheme, and it's really encouraged.
And that course you do, does that involve any kind of classroom work? Do you get together with other graduate management scheme trainees?
Yes, so it's we do residential. So recently we went to Leeds for 3 days, and that was it was just great fun. So you think you've met all the grads, because I think there's about 250 of us or something. And I thought, yeah, I've seen everyone, I've seen people on Teams. I know who everyone is. And I went to Leeds and I was like, oh my goodness, there's like 80 people who almost all of them I've never even met before. But it was just, I don't know, if you like meeting new people, it was so much fun. And actually, I'm a bit introverted, and I don't know, it's good for me to push myself in those situations and be around new people, because I don't know, you learn more, the more you do it, the better you are at it, aren't you? But it was really, really fun. So we had one of those this year. Because of COVID, a lot of them were online the previous year, or it was kind of like the after effects of COVID. They haven't quite moved everything back to being in person. But this year, yeah, we have every module, and a module's like, term time type thing. You'll have one residential where you'll go away for 2 or 3 days with a load of grads. And then you'll also have experiential learning, which is either online or in person. And it'll be like, games, or they get an actor in, and you'll have difficult conversations that you've been scared of having kind of at work, and they give you a chance to practice with an actor. So it's really varied, and I really like it. I like the educational component.
Actually, that brings me back to when you first started the scheme. How was that process, that kind of onboarding, and were you a bit worried about it? Did you feel like were you given quite a lot of support? How was that process?
So the onboarding process, once I'd got through the applying, which was quite long, it's quite long, and we can talk about that in a second.
Yeah, we'll definitely talk about that too.
But once I was on the scheme, I mean, it all happened quite quickly. So you find out that you've got a place. I think I found out in maybe May. I think it was May, and then you start the scheme in September, and you have to do all your pre-employment checks, and you kind of so when I did my application, I said that I was prepared to move for the scheme. So they do consider your like, if you've got a family, or you've got a home, or the factors that might mean that you can't move away. So because I ticked that I was willing to move, when I was offered, it was like, okay, you're going here. I had a choice out of a couple of places, but I think it's different from person to person, and it depends on, because I was willing to go anywhere, I think I had a bit of choice around where I could go. So yeah, I was given a few options, and I decided that I liked the sound of the placements in Bournemouth, Dorset. So I chose that, and I moved here, and it felt like it happened really, really, really quickly. It really did. After a long process of going through the application process.
And was there any support with the move as well with that?
There's a Southwest Leadership Academy, and there is support from the Leadership Academy. So you have a meeting with I think she's called a trainee support coordinator. I can't remember her exact role, Ellie, but she was really supportive. She was on the graduate scheme herself, had to move away for it. So they help you a lot with preparing for moving. Your placement will help you by letting you know and being flexible with when you start the placement. But for me, I just found a flat to live on my own. But I know a girl on the scheme who lived in hospital accommodation for a month before she managed to find somewhere else to live. So there is support. I think you do have to organize a lot of it yourself, but if you need support, it is there, and you can lean on your placements and the actual Southwest Leadership Academy as well.
Okay, excellent. And then when you started the placements again, was that quite supportive? You were kind of introduced to everyone and
Yeah, really, really supportive. Exactly. Yeah. So I was lucky because I was in a team of 30 and I had another graduate in my actual team, which is so nice for me to have somebody who'd moved to the area like me, didn't know anyone. I just felt so lucky to have her with me. And she's one of my best friends now. Um, so I had my friend Fen with me and we did a month of orientation so that you don't start work straight away. You have a whole month to go around and you meet the execs at the hospital, you meet everyone in the team, you meet the finance guys, you meet the HR people. So you meet the porters. I spent a day with the porters, which I thought was really good. You can spend a day in theatres. So you get like a real overview of the organisation you're in. It can vary based on your placement. But I think if you're quite vocal about what you want to do, generally they're really supportive and are happy for you to get kind of put that investment into you so that you fully understand how the hospital organisation works, and then you can give them the best when you start to work.
excellent. And let's talk about the recruitment process then. So what stages did you actually go through and how did you find it?
So I think it's three main stages. The first is a strengths-based assessment, which is like online assessment. It's numerical reasoning and then situational judgment. I was looking online because I was refreshing myself before I did this because it seems like it was almost a year and a half ago now that I did all of this, or even 2 years ago that I was doing all of this. So I had to refresh myself, and it said on there typically takes 40 minutes, and I was thinking, God, I remember it taking so much longer than that. So there's an online assessment that I remember taking. I remember sitting down doing it for ages, but I think I spent quite a lot of time practicing, doing practice assessments and things like that. So you do that first. That's the first thing that everyone does. Once you get through that, you go on and there's a video component. And when I did it, it was kind of like talking to a screen, but there wasn't anyone there. It was just a question would flash up, and then you'd have a bit of time to practice and then record. You'd have to give your answer. I think that one was the one that I was actually most nervous for because it's quite weird having a conversation with yourself when there's no one there. Um, that was kind of the strangest one. And then finally, you have the virtual assessment centre, which is like a half day, loads of strength based activities. You're with other grads, so potentially people that you might be working with later down the line or in the same kind of educational groups as. Um, and I found that quite fun. I was like, a bit nervous and like, nervous behind my screen, but I think I found it really fun because it was like problem solving and we had to do things quite quickly. And I think my advice for that is just to try and be yourself. But I think because of the time pressure, you don't really have time to be any other way. And because you're problem solving, you kind of just have to you're kind of forced to just be yourself. But yeah, I enjoyed that. I don't know if many people will say that they enjoyed the assessment centres, but I did.
Excellent. And then after the assessment centre,
So after the assessment centre, that's when they'll review and score you basically, and then you'll get offered a place on. You either get offered a place on the scheme, or won't.
So did you have a one-to-one interview as well?
No, I didn't actually have a one-to-one interview. So I think they did used to do one-to-one interviews, but they replaced that with the video recording situation. Once I'd found out that I got a place, I met with the Southwest Leadership Academy link, and that's when we looked at what my options were in terms of where I could work.
Okay, excellent. But in terms of that recruitment process, what do you
Mm.
feel they were looking for, or what do you think you did maybe that went well and was to your advantage?
So starting from the beginning, I I practiced the numerical reasoning test, which I know is like really basic, but I'm really glad that I did practice it because just to have a sense of there's if you Google it, there's practice questions out there. If you Google NHS Graduate Scheme tests, you can do practices, and I was really glad that I did that because I knew what to expect when I did the actual assignment and the actual test. And I know that's a small thing, but I think even that could have made a difference for me being able to get on the scheme because they cut the numbers massively just based on that first initial test. Situational judgment test, I don't think you can't really prepare for it, but you have to just think about. I suppose I spent a bit of time before thinking about my personal values and how they align with the scheme. So I would look at the scheme's values because they are online and the golden threads that they talk about a lot, which is inclusivity and diversity. They talk about quality care, the care that you would expect for yourself or your family, and how you can help to deliver that. So yeah, I'd look at the values and the golden threads and think about how you align with those. And then I think having that in my mind when I went into the situational judgment test probably helped, because I was primed kind of to think about my answers based on my values and the values of the scheme. So that's a bit of advice there, I'd say. And I think that probably did make a difference. And then for the video component, like I said, that was the one I was the most nervous for, because I wasn't really sure what questions I was going to be asked. But I tried to think before I went into the video assessment. I thought, okay, what kind of things would I find really difficult to answer? And then I kind of structured a star based answer: situation, task, action, result, and reflection. Based on things that I might find hard to answer, or I thought about some specific situations where I thought about specific situations that could answer a couple of different types of questions, like when I've had to convince stakeholders to do different things, or when I've thought of an innovative idea. And I just practiced recording myself saying those. And then I had those again almost primed in my mind, so that, even if I planned them for a different question, a question would come up and I thought, oh, I can link that to that experience that I'd practiced. So practice, 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 basically.
Yeah, definitely. Though, did you research? Did you go back onto the kind of what they were asking for in terms of the competencies, and to kind of before the video interview to kind of see maybe what sort of questions that you might get, like the stakeholder questions or the innovation?
Yes, exactly. That's exactly what I did. And I looked on Student Room, and there's lots of forums about people talking about I mean, I know you can't rely on it, but it gives you a sense of the kinds of things that they might ask. But I was caught off guard. Like, there's a few times where I was like, oh, I didn't really expect them to ask that question. But because I'd spent so much time thinking about the types of things I might say, I didn't feel like I was completely off guard. And you have a bit of time to prepare your answer as well. So yeah, I think that helped.
Sounds like preparation is definitely key.
Yeah, basically, that's what I'm going to keep hammering hammering home. I was going to say, and also just being organized with timings, because there are deadlines for doing each of the various components. And I wish I'd been a bit more organized. I felt I was kind of rushing a little bit, but if you look ahead and kind of mark your calendar with when things need to be done, you probably feel a lot more in control than I did.
And the assessment center again, was there
Yeah.
like specific things that maybe you felt went well for you in the assessment center?
I have to just think for a second about, because I did I'd done another assessment center at the same time for a different graduate scheme, so it kind of blurs a little bit. They were, I think, days apart. So I did the one for the local government association, I believe it was called, a few days before, and in a way I think that set me up quite well for the one that was a few days later for the NHS. um, but again, I think I looked at what to expect. It was again really thinking about what are my values and how will I show those? How will I tried to make sure, because I've mentioned already that I'm a bit introverted, so I had to think about, if I have an idea, say it, Isabella. Like, I had to tell myself that make sure you say what you think if you feel passionately about something. And also I was trying to encourage people that maybe didn't say as much, asking them, because that's a way of showing, like equality or inclusion, for example, people who maybe are a bit quieter, encouraging them to speak up in the assessment center. And I wonder if that helped me slightly, maybe. um
I think that's quite a key actually, because sometimes people think that they need to be really, be the one with all the voice and speak as much as
yeah,
possible, but actually it's not. It's about incorporating other people and working as that team.
exactly.
So having that skills where you can bring people in probably did play to your advantage.
Yeah, I think it probably did. And also calling back on things that people have said to show that you're listening. So, oh, this person said that was a really good idea. Why don't we do this? So I think that shows active listening, and yeah, not dominating like like you just said, because sometimes that can go against you.
Excellent. And I know we maybe should have talked about this right at the beginning, but
Mm,
in terms of applying to the NHS, the applications open really early, don't they? And they
they
close
do.
early.
Yeah.
So if you're in your final year, do they, when, do you remember what the timeline was for that?
Yeah. So I think the first part, which is the online assessment that everyone has to do, I think that closes November 7th of November, so it's already closed. So if you'd have to apply for the next year now, so you have to kind of be on it from the beginning of your final year, which is why I ended up having to do a year out before I started. But yeah, the very first bit you have to be done by the 7th of November.
Yeah, that's the assessment, because I think possibly even October is the closing date for that initial form, or to then be invited for the assessment. So yeah, really,
Probably
really
you're
soon.
right. Yeah.
So I mean, it's so interesting hearing about everything you've gone through and the process. What next then? So I know you said that you're not sure what you want to do. You've got ideas, but in terms of the scheme, once a graduate completes the scheme, do they then apply for roles within the NHS?
So you don't have to apply for roles within the NHS, of course, but you're set up to get a band 7 job within the NHS. And if you don't work for the NHS, you probably don't really know what band 7 means. But it's kind of at my age, I'm 25. It's unlikely that I'd be on a band 7 job because I wouldn't have had enough experience if I hadn't gone through the graduate scheme route. So it's a management position basically. And because I've been on the scheme for 2 years already, doing 2 years worth of band 7 roles, I've already can say that I've got 2 years of band 7 experience, and I'll be able to get a band 7 job when I finish the scheme within the NHS. So for me, I probably will stay within the NHS and I'll try and get a band 7 job. Some people get a band 8A job, which obviously then push, they're already that jump ahead. So I think I and most people will probably stay in the NHS for a little while, because you're so well set up to kind of continue on. But you got take this, you're not guaranteed a job at the end. You have to go through the normal application process like normal, but you have that experience behind you, and you have, because of the competencies, I'm not just doing a typical project manager role. I'm doing a really versatile project manager role that I can use experience. I'll be able to use the competencies to match myself to a job description basically. So yeah, I'm saying probably the same thing over and over again, but basically you're very well set up to get a good NHS job afterwards. But you don't have to. Some people will go on to work for private or industry, and this experience that you get is completely transferable. So you don't have to stay within the NHS. But I think, we're primed to, basically.
So it's an excellent fast track way of going into a leadership role, isn't it? Well
Yeah,
done for getting onto it, because I think a lot of us know it is very competitive, isn't it, this scheme to get onto. So
exactly.
you've done amazing to get onto it, so congratulations.
Oh, thank you. I was thrilled when I got onto it. I remember I got the phone call and I put the phone down and I cried afterwards because I was just so happy that I got onto it.
Oh, I don't blame you. I don't blame you.
One thing I've just thought of, I mean, I would say, for anyone who's applying for the scheme, don't be afraid to go on LinkedIn and try and find maybe a local graduate or somebody who's on the scheme, because I think we're really willing to talk about our experiences and support. We get given a buddy when we're on the scheme, so we're actively helping somebody who's the cohort behind us. So we have experience with kind of helping people get through the process. So yeah, I think the guys that I know are all really friendly, and we'd be happy to help anyone who is thinking about applying for the scheme or has any questions.
That's brilliant. I think, yeah, excellent. I think that's such a useful resource, using LinkedIn, and offering that, and saying that you're all willing to help is really great. Brilliant. Well, thank you so much. It has been really interesting, just gaining that insider's view of that whole scheme and through the recruitment process. So I really appreciate giving your time to talk to me today. So thank you.
Thank you. It's been lovely to talk to you. No problem at all.
Thank you. Thank you for listening today. Please remember to subscribe and follow so you can keep up to date with all new episodes.